In 2001, Aruba introduced the Allgemeine Ziektekostenverzekering, or AZV. This universal safety net was designed to ensure every resident had access to medical care, regardless of their income. It was a success, helping the population reach new milestones in life expectancy. But that success has created a paradox. As Arubans live longer, the island is facing an explosive rise in non-communicable diseases, specifically chronic conditions like diabetes and heart disease. These conditions aren't treated with a single surgery or a round of antibiotics. They require lifelong management, which places a massive, constant strain on the island's clinics, hospitals, and medical staff. Because the system was built to handle acute illnesses rather than decades of chronic care, the very success of Aruba's healthcare model has created the conditions for its own financial collapse. The current AZV model is almost exclusively curative. It is a reactive system, built to wait until a person is already sick before it triggers a response. This creates a blind spot. Essential preventative measures, like routine physicals, like dental cleanings, and early mental health support, are largely excluded from standard coverage. This chart compares the lifetime cost of care. Managing hypertension or blood sugar early is a predictable, low baseline expense. But if those symptoms go unchecked, the cost of treating a resulting stroke or kidney failure is a staggering multiple of that early care. Without a structural pivot, the rising volume of these high-cost, late-stage interventions will eventually make the entire AZV system unaffordable. To save the system, the focus must shift from expensively treating the ill to proactively protecting the healthy. The path forward begins with expanding the AZV mandate. The system must evolve to cover the frontline interventions that stop disease before it starts. Primary care must become a proactive partnership. Instead of seeing a doctor only during an emergency, residents would engage in routine screenings and lifestyle coaching to identify risk factors early. By utilizing early diagnostic tools like routine glucose monitoring, healthcare providers can catch a trend toward diabetes and intervene with lifestyle changes while the condition is still reversible. Supporting this requires new structural mechanisms, shifting budget away from late-stage curative services into a dedicated preventive fund, updating national health legislation, and introducing performance-based incentives for doctors. Reforming the health of a nation isn't just a medical recommendation. It requires realigning the legal and economic structures that drive Aruba's healthcare economy. Managing a nationwide prevention system produces a massive amount of data. Processing these millions of data points to provide personalized care is a task far beyond human administrators. This is where artificial intelligence becomes the system's nervous system. Algorithms can analyze population-wide data to identify high-risk groups based on subtle patterns, often before physical symptoms even appear. Automated diagnostics can then assist in interpreting screenings for cancer and cardiovascular disease, providing near-instant analysis that allows for much faster intervention. For the patients, AI takes the form of virtual assistants, offering 24/7 health guidance, providing vaccination reminders, and using behavioral nudges to help them stay on track with their wellness goals. With these tools, the AZV transforms from a reactive safety net into an active, predictive radar system for the island's health. In this new model, the location of healthcare changes. It moves out of the hospital and doctor's office and becomes integrated into the rhythm of daily life. We begin to see health integration everywhere, in school-based screenings for children, wellness initiatives in the workplace, and community outreach programs that bring care directly to the neighborhood level. Individuals take an active role, using digital health technology and localized screening units to monitor their own metrics and stay connected to the AZV network. The payoff of this reform is a more resilient and economically productive society. By catching issues early, the workforce stays active and the population remains fundamentally healthier. Ultimately, a reformed AZV succeeds when it stops reacting to medical emergencies and starts sustaining long-term health, ensuring that a longer life in Aruba is also a healthier one.